Welcome to Lesson 5, ICD-10-CM Conventions and General Coding Guidelines. This lesson covers sections IA and IB, the core conventions and general rules you will use for every diagnosis code. KS Medical Coding Academy, Full Course 2025-2026. Lesson Importance. ICD-10-CM Conventions and Guidelines are the foundation of accurate diagnosis coding. Every chapter and every code you assign depends on these rules. Master sections IA and IB first, and all chapter-specific coding becomes far easier. Lesson Overview. In this lesson we will cover 19 conventions, labeled A1 through A19, and 19 general coding guidelines, B1 through B19. You will get over 120 slides of examples, explanations, and tabular list guidance, all aligned to the official ICD-10-CM FY 2026 guidelines. Structure of ICD-10-CM. ICD-10-CM contains two main parts, the alphabetic index and the tabular list. Begin your search in the alphabetic index, but always verify and confirm codes in the tabular list. The tabular list contains the official coding instructions you must follow. Code format. ICD-10-CM codes are alphanumeric and contain 3 to 7 characters. The first character is always a letter. The second and third characters are usually numbers. Characters 4 through 7 may be letters or numbers. Categories. The first 3 characters form the code category. For example, E11 indicates type 2 diabetes mellitus. Think of the 3-character category as the broad diagnosis family. Subcategories. Characters 4 through 6 increase specificity. They tell you site, severity, etiology, or laterality when applicable. Always code to the most specific subcategory supported by documentation. Subclassification. The 7th character is an extension used to indicate episode of care or other special meanings. It is commonly required for injuries, fractures, and many obstetric codes. Abbreviations. NEC. NEC stands for Not Elsewhere Classifiable. Use NEC when the provider documents a specific condition but ICD-10-CM contains no exact code for that detail. Abbreviations. NOS. NOS means Not Otherwise Specified. Use NOS when the provider's documentation is too vague to assign a more specific code. When NEC is used. NEC is used when documentation is specific, but the ICD-10 system lacks a precise match. In the tabular list or index you'll see NEC used as Other Specified Language. When NOS is used. NOS is used when documentation lacks sufficient detail. For example, pneumonia, unspecified, indicates NOS because the organism or type is not documented. Punctuation Overview. ICD-10-CM uses special punctuation, brackets, parentheses, and colons. Each symbol has a distinct meaning that affects code selection. Brackets. Brackets commonly enclose manifestation codes or synonyms in the tabular list. For example, a term in brackets may indicate the manifestation code that should accompany an etiology. Parentheses. Parentheses indicate non-essential modifiers, additional words that do not change the code assignment. They help you read the term but generally do not affect code choice. Colon. A colon in the tabular list denotes that the term before it is incomplete and requires one or more modifiers to complete the diagnosis phrase. Always include the words that follow a colon to determine the correct code. Includes notes. Includes notes clarify what a category covers. They show conditions that are included within that code group and help you interpret the code's scope. Includes examples. For example, a category for Alzheimer's disease may include dementia as part of that code's meaning. Read includes notes to avoid over or undercoding. Excludes notes overview. There are 2 types of excludes notes, excludes 1 and excludes 2. These instructions are critical for correct coding and must be followed exactly. Excludes 1 definition. Excludes 1 means, not coded here. When you see an excludes 1 note, those two conditions cannot be coded together for the same patient encounter. Excludes one examples. Common excludes one situations include congenital versus acquired forms of the same condition, or mutually exclusive states where both codes cannot be reported together. Excludes two definition. Excludes two means, not included here. In excludes two situations the two conditions may be coded together, if supported by documentation. Excludes two examples. For example, hypertension may have an excludes two note referencing certain heart conditions, meaning both the hypertension and heart condition can be coded together when appropriate. And, equals and or. In ICD-10-CM the word, and, in a code title is interpreted as, and or. This means either one condition alone or both conditions together may be applicable. Example. For example, the phrase, diabetes and kidney disease, should be read as, diabetes and or kidney disease, for coding purposes. With, or, in. The words, with, or, in, are used to indicate a relationship between conditions. ICD-10-CM presumes a cause and effect linkage when, with, appears in a code title unless the documentation states otherwise. Diabetes, with, examples. If a record states, diabetes with neuropathy, the, with, implies that the neuropathy is due to the diabetes and you should code accordingly. You do not need an explicit sentence like, due to diabetes in the note. Exception rule. Do not assume linkage when the provider clearly documents that two conditions are unrelated. When the record separates conditions, code them as separate, unrelated diagnoses. C. The instruction, C, is mandatory. When you see, C, in the index or tabular list, follow the reference to the designated term. See also is an advisory reference. It suggests related terms or locations to check, but it is not mandatory like, see. Etiology Manifestation Convention. Some conditions require two codes, one for the etiology, the other for the manifestation. The tabular list will indicate sequencing and whether both codes are necessary. Code first. A. Code first note indicates that the underlying cause must be coded first. The manifestation is then coded as an additional code. Use additional code. A. Use additional code. Note tells you that a second code is required, often to identify the manifestation, organism, or complication. Example. Diabetes. For example, diabetes with renal disease requires coding for diabetes, such as E11.22, followed by the CKD code showing stage A19. Follow the tabular list sequencing. In diseases classified elsewhere, codes labeled in diseases classified elsewhere are manifestation codes and should never be first listed. They must be sequenced after the underlying condition. Relational terms. Relational words include due to, associated with, and following. These terms help define the causal or temporal relationship between diagnoses. Due to indicates a cause and effect relationship. For example, heart failure due to hypertension implies hypertension is the underlying cause. Following suggests a temporal sequence, that the second condition developed after the first. Associated with indicates a clinically documented relationship. Always confirm the relationship in the record before assuming causation. Other versus unspecified overview. ICD-10-CM distinguishes between two important terms, other and unspecified. Other is used when the provider gives a specific detail but there is no exact ICD-10 code. Unspecified is used when documentation lacks sufficient detail to assign a more specific code. Other. Use other when the provider documents a specific diagnosis, yet ICD-10 has no exact matching code. For example, a provider may document other viral pneumonia that calls for an other code when applicable. Unspecified. Use unspecified when the provider's documentation is incomplete or vague. If the record simply states pneumonia, with no further detail, you must use an unspecified pneumonia code. Correct usage examples. Remember, other gastritis is used when the provider specifies a type that the index doesn't have a precise code for, while unspecified gastritis is used when no type is documented. Placeholder, X, Introduction. The placeholder character, X, preserves code structure when a seventh character is required but earlier character positions are empty. It keeps the code positions aligned for correct extension placement. When to use placeholder. Use the placeholder, X, whenever a category requires a seventh character but the code has fewer than 6 characters filled. This is common in injury, fracture, and obstetric codes. Placeholder example 1. For example, T45.52XA shows the X as a required placeholder so the seventh character, in this case A for initial encounter, can be correctly appended. Placeholder example 2. Another example. A19.21X0. Here the X holds the position so the code can accept its required extensions in OB and injury chapters. Seventh character overview. The seventh character is an extension used in many chapters, especially for injuries, fractures, and obstetrics, to indicate encounter type or healing status. Seventh character. A denotes the initial encounter. This is used while the patient is receiving active treatment, such as in the emergency department or during surgery. Seventh character. D denotes a subsequent encounter, used for aftercare and routine healing visits when active treatment is no longer being provided. Seventh character. S denotes sequela, a late effect or residual condition that remains after the original injury or illness has healed. Seventh character example 1. For a tibial fracture, you may use A for the initial visit with active treatment, D for follow-up visits during healing, and S for chronic pain considered a late effect after healing. OB-specific seventh characters. Obstetric codes often require specific seventh character details such as the trimester, the number of fetuses, and the encounter type, so always check the tabular list for OB-specific extensions. Laterality overview. ICD-10 codes commonly specify laterality, right, left, bilateral, or unspecified. Laterality improves specificity and is an important part of accurate coding. Right, left, bilateral. Examples. H16.011 is coded for the right eye, H16.012 for the left eye, and H16.013 when both eyes are affected. Use the exact laterality documented. Placeholder for future expansion. Some codes reserve unused character positions for future expansion or to maintain compatibility with seventh character requirements. These placeholders allow future updates without restructure. Subterms in index. The alphabetic index uses indentation to show subterms. The first indentation is a subtype, the second is a subcategory, and the third gives specific detail. Read the indentation carefully. Subterms example. For instance, under the main term, PAN, you might see abdominal as a subterm, and then right lower quadrant as a more specific indented term. Each level narrows the code selection. Multiple coding required. Certain diagnoses require more than one code to fully describe them. This often follows the etiology plus manifestation principle and the code first instruction. Multiple coding symbol. In the alphabetic index, a bracketed code or other indicators show when multiple codes are required. Pay attention to symbols and bracketed entries in the index. Cross-references. Cross-references in the index point you to the correct code range, the primary main term, or linked diagnoses. They save time and prevent miscoding. C condition. When the index says C condition, it means the term you looked up is better coded under a different condition heading. Always follow that direction to the appropriate entry. Complex cross-reference example. For example, abscess, lung, C pneumonia. This tells you that a lung abscess is treated as an infection and coded under pneumonia entries when appropriate. Instructional Notes Intro. Instructional notes in the tabular list guide sequencing, code combinations, and other special coding needs. These notes are mandatory instructions. Read them before assigning a code. Use additional code. Note: when you see use additional code, you must assign a second code to identify specifics such as the organism, the drug, or the stage or severity of a condition. Code first. Note: a code first instruction tells you the underlying condition must be sequenced before the manifestation. Always follow the tabular list sequencing instructions. Category-specific notes. Category-specific notes appear throughout the tabular list and provide essential guidance for diseases like diabetes, COPD, hypertension, and CKD. Follow these notes exactly. Section B Introduction. Section IB contains 19 general coding guidelines that govern all coding situations: outpatient, inpatient, emergency, and claims submission. These rules are mandatory and universal. Locating a code. Always begin your search in the alphabetic index to find the main term and subterms. Then you must verify your selected code in the tabular list. Never code directly from the index. Tabular confirmation. The tabular list contains includes and excludes notes, instructional notes, and seventh character requirements. Verification in the tabular list is essential before assigning the final code. Level of detail, specificity. Assign codes to the highest level of specificity supported by the documentation. Use all available characters when the record supports them so your coding is precise and defensible. Do not use truncated codes. Do not use truncated codes that end with a dash or are missing required characters. For example, use J18.1 rather than an incomplete J18 when more detail exists. Code to full number of characters. When codes have required characters, 4th through 7th, include them all. Use placeholders where necessary to correctly place extensions such as the 7th character. Acceptable 3-character codes. A 3-character code is acceptable only when the category has no subdivisions. If subdivisions exist, you must select the most specific subcategory code available. Signs and symptoms. Signs and symptoms should not be coded when a definitive diagnosis has been documented. If the diagnosis is known, code the diagnosis rather than its signs or symptoms. Conditions integral to a disease. Do not assign separate symptom codes for manifestations that are integral to a condition. For example, do not code cough separately when the provider documents pneumonia. Conditions not integral. If a symptom is not routinely part of a disease, code it separately. For example, vomiting with gallstones is not an integral symptom and should be coded in addition to gallstones. Multiple coding for a single condition. Some medical conditions require 2 or more ICD-10-CM codes to fully describe the clinical picture. This is called multiple coding. Most often, it follows the etiology and manifestation pattern. Whenever you see notes such as code first or use additional code, this means multiple coding is required. Always assign codes in the correct sequence based on these instructions. Etiology plus manifestation explanation. In the etiology manifestation structure, the first code represents the cause, the underlying disease. The second code represents the effect, or the manifestation of that disease. For example, in diabetic neuropathy, we code the diabetes first using E11.40, and then we add the neuropathy code, such as G63. The underlying disease always comes first. When is multiple coding required? Multiple coding is required in 3 situations: when the tabular list instructs the coder to assign more than one code, when the index shows bracketed codes, when manifestation codes include the phrase, in diseases classified elsewhere, meaning they cannot be used alone. In all these cases, 2 or more codes must be assigned to describe the full condition. Examples. Common examples of multiple coding conditions include heart failure due to hypertension, chronic kidney disease due to diabetes, Neuropathy caused by vitamin B12 deficiency. All of these require both an etiology code and an additional manifestation code. Acute and chronic conditions. When a provider documents a condition as both acute and chronic, and when ICD-10-CM provides separate codes for each, you must assign both codes. The acute code always appears first because acute conditions take sequencing priority. Example. For example, if the diagnosis is acute and chronic cholecystitis, we assign K81.2 for the acute form, and K81.1 for the chronic form, and we sequence the acute form first. Exception. If ICD-10-CM provides a single combination code that describes both the acute and chronic forms together, then only that one code is assigned. For example, acute on chronic tonsillitis is coded with J03.91. Combination codes definition. A combination code is a single ICD-10-CM code that includes more than one clinical concept. This may include a diagnosis and its symptoms, a diagnosis with a manifestation, two closely related diagnoses, a diagnosis with a complication. Combination codes reduce the need for multiple codes. When to use combination code. You must use a combination code when the tabular list provides one. The alphabetic index lists the diagnosis as a single entry. The combination code accurately captures all documented components. Always check if one code is sufficient before assigning multiple codes. When not to use combination code. Do not use a combination code if the documentation does not support every element of the code description. The two conditions are not clinically related. The combination code does not capture all documented details. In such cases, separate codes must be assigned. Examples. Examples of combination codes include hypertension with heart disease, diabetes with chronic kidney disease, COPD with acute bronchitis. In these scenarios, the combination code accurately represents the full clinical condition. Complex examples. For example, hypertension with chronic kidney disease. We use the hypertensive CKD combination code I12.9, and then we add the CKD stage code, such as N18, X. This follows the combination code structure plus a required additional code. Sequela, late effects, overview. A sequela, or late effect, is a residual condition that remains after the acute phase of an illness or injury has resolved. Examples include chronic pain after a fracture, or paralysis following a stroke. Sequela coding always reflects a past condition that has long-term consequences. Sequela rules. In sequela coding, you must always assign two codes. First, the current residual condition, which the patient is experiencing now. Second, the original condition, reported with a sequela code showing that it caused the residual problem. Sequela sequencing. The correct sequence for sequela coding is 1. Current residual condition, coded first. 2. Sequela code, coded second. Example. Chronic pain after a healed femur fracture, G89.21 for chronic pain. Followed by the fracture code with a seventh character, S, for sequela. Sequela example 2. For a patient with left-sided hemiplegia due to a previous stroke, we assign G81.94 for the hemiplegia, then I69.35 for the stroke sequela. This follows the two-code sequela rule. Do not code acute illness. Important. You must never code an acute injury or acute condition together with a sequela. If the condition is truly a sequela, the acute phase has already ended. Impending, threatened conditions. When documentation describes a condition as impending or threatened, follow this rule. If the condition actually occurs, code the confirmed condition. If it does not occur, check the index for specific, impending, or threatened codes. Example. For example, threatened abortion is coded directly as O20.0. Impending rupture of an aneurysm is only assigned if the condition does not occur and if a specific code exists. B11. Important rule. If the alphabetic index does not provide a code for an impending or threatened condition, then code the underlying condition and any associated symptoms instead.